And we've arrived at this time of year, once again, Medicare's annual open enrollment. So we will be speaking about these points, the difference in the plans, what annual open enrollment means, what changes you make during this annual enrollment period, AEP for short, what's new for the year 2017 in regards to the plan, steps that you can take during this so that you can make sure that the changes that you make are all of the changes that you need to make, and then special assistance programs that are there to help you with the different parts of Medicare and the other considerations that we need to talk about in regards to Medicare. Let's start with the brief overview of the plan differences. When we talk about Medicare, there are two ways that you can get your Medicare coverage. One of the ways is through original Medicare. Many people call that straight Medicare or standard Medicare, but Medicare refers to it as original Medicare, wherein from the Social Security Administration you've gotten your Part A, which is your hospitalization, your Part B, which is your medical insurance. That's where your doctors and the doctor's tests or durable medical equipment is ordered from. That Part B takes care of that. Then there's the standalone Part D plan, which is your prescription drug plan. And only if you're on original Medicare, then you have the responsibility of deciding on a Medicare supplemental plan, otherwise known as a Medigap policy. So that if you get your coverage through original Medicare. The other way that you can get your Medicare coverage is through Medicare Part C. Now we're talking about Medicare Advantage plans or HMOs and PPOs. If you get your Medicare coverage through those, then you will have your Part A, your Part B, and your Part D services through one organization, an HMO or a PPO. Now, you'll see on the slide that it says there you make a decision about Part D, but no longer is that the case because now all of the plans for 2017 have Part Ds or prescription drug plans as part of the composite HMO or PPO. So we're going to be talking about those in greater detail, and one of the things you're going to notice is that I will be repeating this information, and that's because Medicare is very complex. So sometimes you'll need to have things said in a different way, and that way you grasp the gist of what is being said. So if you see that redundancy, don't worry about it, it's built in for a reason. Let's start with talking about what the annual enrollment period is about. Every year, this occurs on the dates October 15th through December 7th. This is the period of time during which people with Medicare plans can make changes to that coverage. The last change that the person makes takes effect January 1st of the next year, in this case, 2017. Now, I'm going to ask you this question again, so remember, the annual open enrollment period is October 15th through December 7th of every year. So be prepared when I ask you that question so I can make sure you understand that. Now, what changes can you make during the annual open enrollment period? First thing you want to do is to review your current plan to see if there are any upcoming changes. That's the first thing that you want to do, because you may find that the plan is the same and there's nothing else for you to do, because it's entirely possible that that's the case. So the first thing you're going to do is review. The next thing you're going to do is to switch, to know that you can do, is to switch from original Medicare to a Medicare Advantage plan or Part C of Medicare, or you can do vice versa. Switch from Medicare Advantage plan to original Medicare. If you notice there, oh, did it switch? Let me make sure that switched. There we go. So we can switch from an Advantage plan to a different Medicare Advantage plans. So that's three things that you know you can do. You can switch from original Medicare to a Medicare Advantage plan, or vice versa, or you can switch from Medicare Advantage plan to another Medicare Advantage plan. The fourth thing that you can do is switch from a Part D plan to a different Part D plan during this period of time. You can sign up for a Part D plan for the first time if you have Medicare Part A or Medicare Part D. The changes that you make during this annual open enrollment period, the last change that you make takes effect January 1st of the next year, 2017, in this case. Okay? Now, we talk about the different parts of Medicare, and I'll get your question in just a second. Part D has premiums connected with it and deductibles. Part B has premiums and deductibles connected with it. So you'll call our SHIP office, and I'll give you that information later on that's going to help you know that those costs, as those costs are made available to us. The same way with the MA plans, which are the Medicare Advantage plans, and also the other Part D plans. They are available for us to review what's going to be happening to that plan in 2017, starting October 15th through December 7th. And that's why this is established as an open enrollment period, so that we can help Medicare beneficiaries see what's going to happen. So you see, the annual open enrollment period, we get to look into the future. Now, Miss, you had a question.
Well, I have an older friend, and so she has cancer, so I'm not sure quite where she's at with things. So if she didn't do anything, what would happen with all of her? So I need to know how I have to counsel her.
Okay.
If I get
If your friend, and let me repeat the question for those who are in the remote offices. The question is, if you have a plan, and I'm just paraphrasing for them,
yes.
If you have a plan and you do absolutely nothing, what will happen to that plan for the next year? The answer is, what your friend needs to do is she needs to review the plan, because if she does absolutely nothing, she will stay in that same plan, including all the changes that plan is going to make. They're going to automatically re-enroll her for 2017. And she won't be able to disenroll if she finds that something that has changed that she doesn't like. Like, for instance, a medication that used to be in 2016 may no longer be on a plan in 2017. Or the cost of the plan may have gone up, be it the premium or the deductible, and it may present a hardship for her, and she may not be able to get off that plan if she goes past the open enrollment period. So you want to advise her to, either you on her behalf or someone, to at least review the plan so that she'll be aware of what's going to happen. Yes, ma'am.
I would also like to add the most pertinent thing is the drugs in her case, to make sure that her drug coverage is the same, because the formularies can change on this plan. So that's what, in her case, I think she needs to be really critical of the drugs she needs and how much they're going to cost in 2017.
Now, for the benefit of those in the remote office, I'm going to repeat the answer that one of the audience members makes, is that they emphasize that you want to make sure that you take a look at your Part D, which is your prescription drug plans, because those formularies will change from year to year, and you want to make sure that the medications that you're taking are going to be on that plan for the year 2017. Yes, ma'am?
I have a question. Medicare and Medicare Advance. Medicare Advance means like me, like I'm in Humana, Medicare Humana.
Mm-hmm.
That is Medicare Advance.
Okay.
Or I don't know about
Okay.
why.
Okay. And I'm going to repeat the question for the benefit of those, because we don't have a microphone. Usually what I do is I talk, and then I open it up for a microphone at the end of it. But because we have so few people here, I take the question so that you don't forget your question. So I'm going to repeat your question for the benefit of those who are looking in on the remote sites. And the question was the difference between Medicare and the Medicare Advantage plans. Am I correct that that's what you want to know the difference is? Well, if you have Medicare, or you have a Medicare Advantage plan, say like Humana or any of the other Advantage plans, you are still in Medicare. It's just that through the HMOs or the PPOs, you are receiving your Medicare services. They manage your Medicare. So if you have a problem with something, you won't go to Medicare, like call the 1-800 number. You go to your plan first, because they are the ones that are handling your Medicare, but you still have Medicare. You just chose to get your Medicare services through your HMO that you chose. Did that help you to understand that? Okay, very good.
And that's different than a supplement plan.
That is different than a supplement, and I won't go into the question that was asked for those benefits in the remote office is a Medicare Advantage plan different than a Medicare supplemental plan? The short answer is yes, and as we go along in the discussion, I'm going to cover more of that. So the short answer is yes, it is very different. Okay, now to the next point, what's new or changing in 2017, and here's what you really do need to take note of. Everyone that has a plan will receive notification of changes. Individual plan changes will be mailed to you in what is called an ANOC, that is an annual notice of change, or an EOC, that is an evidence of coverage. When you get either your ANOC or your EOC, it will show any changes in premiums, deductibles, copays, any changes in the cost or coverage of medications, or changes of those medications, any changes in the covered services. So if you were receiving a certain type of service from your Medicare Advantage plan, say your HMOs or your PPOs, then when you get your notice of change, either your evidence of coverage change or the annual notice of change, it will show you what's going to be different for the year 2017 so that you will know it. Now, we as counselors at the SHIP office will also know that information, but I want you to understand that the plans have an obligation to send you in letter form the changes for the next year. So you know how this time of year you're being bombarded with a lot of information from a lot of different sources? You may want to disregard the commercials and the advertisements, but please do not disregard the annual notice of change or the evidence of coverage, because those are actual required letters that are sent to you to tell you what changes are going to be made to that plan. Yes, ma'am?
Will it be an actual letter or the book that's this thick that you don't have time to read?
For the benefit of those in the remote office, the question was asked, is it going to be an actual letter or is it going to be the big book that's too thick to read? Well, the answer to that is that you will notice that it's going to say this is not a bill. You're going to notice that it's going to have the title Annual Notice of Change, and it'll be like a pamphlet as opposed to a book. The big book that you get will say Medicare and You in 2017. That's going to be the thickest book that you get, other than the formulary change or one of your changes as far as what your Medicare Advantage plans were saying. Now, I have another comment. Go ahead. You got a book, and it was an annual notice of change? All right. So sometimes, depending upon the changes that you get, there's going to be a lot or a little. In either case, you keep that, because now you can ask us as counselors at the SHIP office what the changes are, and we can go through for them, but the book outlines the changes that that company is going to make in each of its parts, be it the Part D, which is your prescription drug plans, or what medical services they're going to continue to cover or that they're no longer going to offer. So if it's pretty complex and detailed, then yeah, it's going to be a thicker book. And so just read it in parts so that you'll be aware of what's going to go on. Okay? Okay, moving on. The standard Medicare Part D drug benefit contains a donut hole or a coverage gap where beneficiaries, in addition to their premiums, will pay 40% more for their covered brand name medications or 51% for their covered genetics. This is standard, and this is where I usually say that people ask me all the time, Does Obamacare affect Medicare? Now, let me get through reiterating and reiterating what the next two bullet points, and then I'm going to answer the question about how Obamacare affects Medicare. So in 2017, when Medicare beneficiaries reach an out-of-pocket cost of $3,700, they enter the donut hole. With each plan, once they paid $4,950 out-of-pocket costs in 2017, they leave this donut hole or coverage gap and only pay 5% or a smaller amount for each of their drugs for the remainder of the year. Now, let's put all that into context, okay? I don't know who came up with the word donut hole. It wasn't my invention because it's a medication coverage gap. What happens, and it's happened every year, and it's going to continue happening until about the year 2020. Congress has made a set of laws, part of the Affordable Care Act, which most people call Obamacare. The Affordable Care Act has a set of laws designed to close this medication coverage gap so that by the year 2020, there will no longer be a medication coverage gap. So the way that it works is you pay about 25% for your medications. Your company pays the remaining percent until you reach this threshold of this $3,700. Then the percent of your part of the payment for that medication goes up. Like it says there, 40% if it's a brand name, 51% if it's a generic, until you reach the upper limits of that coverage gap. Then, after you've paid that, you and your plan have paid that out-of-pocket expense, you drop down to pay only 5% for the remaining of the year. It's 5% or whatever's lower for the medications. It's different for different medications, it's different for different plans. And you'll pay that for the rest of the year, and then you'll start all over again. So the Obamacare, or the Affordable Care Act, set of laws is going to make it so that each year you pay a lower and lower percentage until you get to the point where you'll be paying the same thing that you paid at the beginning of the year. So that is one of the few ways that the Affordable Care Act, or the Obamacare, has impacted Medicare. Okay? So let's look at some steps that we can take during this AEP. And here's where the first question comes in. What does AEP stand for? Annual enrollment period. And we're talking about what period of time? Right, October 15th through December 7th of every year. Very good, very good. So, when you are in that period of time, and that's where we are now because we passed October 15th, you want to look at your current Medicare health and drug coverage. Find out whether your Medicare costs and benefits will change in the coming year. If you have a Part D plan or a Medicare Advantage plan, look at either the annual notice of change, the NOC that we were just talking about, or the evidence of coverage that we were just talking about to see what plan changes are going to take place for the upcoming year. Look at the Medicare and You book, that big handbook that you're going to get, because it talks about changes to Medicare, okay? If you want a Medicare and You book and you did not receive one, then you can call Medicare and they will send one to you free of charge. And if you don't receive a notice, then you call your plan. They are the ones who are responsible for making sure that you get a notice, of an annual change notice or an evidence of coverage notice. Here's some other things that you want to keep in mind to do. You want to ask yourself the following questions that you see either on the slide or in the handouts that you have. Ask yourself these questions about your Medicare coverage options so that you can make sure you're getting the best coverage possible for you for the upcoming year. Assess your health care needs. What are my current health care needs? What are my current health and drug costs? How often do I go to get healthcare service or healthcare service information? What type of insurance does my doctor accept? What prescription drugs do I currently take? What pharmacies do I go to when picking up these drugs? Do I travel a lot? Where do I go to receive health care? When you come to our offices and we are talking about your plans, these are some of the questions that we ask because we want to help you ascertain what your needs are so that you can find a plan that's going to best fit those needs. Now, they might not custom fit them, but fit as closely as possible to your lifestyle and your medical needs. So keep in mind those questions. Circle those when you're going back over this later on today. Know the main difference between original Medicare and Medicare Advantage plans. Just like we've had questions about that today, because they are different. So know the main difference between the two. Compare the Medicare options and think about coverage, benefits, costs, and restrictions, because those are going to be the things that's going to help you in making your decision as to what type of Medicare plan you're going to need for the upcoming year.
Are the Medicare Advantage plans usually better?
Okay. The question that's being asked is, are the Medicare Advantage plans usually better? And in answering that question, I'm going to pose another question, because this is one of the main questions we get as Medicare benefits counselors at the SHIP office. What's the best plan out there? That's what I want. The answer to both questions is it depends upon what is best for you. There are people who like original Medicare for a variety of reasons. Then there are people who like HMOs or PPOs, Medicare Advantage plans, for a variety of reasons. The answer truly depends upon what is best for you and your situation and circumstances. And that's one of the things we have that happens all the time when we have beneficiaries come in, is they say, well, my friend, he has that or she has that, and they pay less than that. How come I don't? And I think it's going to be highway robbery because I know good and well that I pay more for my medications or pay more for my medical services. And one of the things that we point out to you is that your situation may be very different from your friend's situation. In talking with your friends, they may have left out critical points that are necessary to take into consideration when we talk about your Medicare coverage. That is why we, as counselors at the SHIP office, go through the questions we just went through and many, many more. So when you make an appointment to come into the SHIP office, it's not going to be a 10-minute visit, because we have to ask you these questions and more to make sure that we are taking everything into consideration, not in choosing a plan for you, but in helping you to make a choice, things that you need to consider. Yes, sir?
If you have the original Medicare and you have a supplemental, does that supplemental always cover the 20%, no matter where you might be in the country?
The question that the gentleman is asking is, if you have original Medicare and a Medicare supplemental, also known as a Medigap policy, does it cover you anywhere in the country? And the answer is yes. In the 50 states and in the territories of the United States, the original Medicare and the Medicare supplemental plans are designed to work together no matter where you are. Okay. Let me see. Am I on this? Okay, there we go. Let me see.
Well, can I ask one more question?
Well, go ahead.
So what are some of the, reasons people like original Medicare? You said it's a variety of reasons. So what would be some of the reasons for liking original Medicare versus Advantage Medicare?
Okay. The question that's being asked is, what are some of the reasons that people like original Medicare versus people liking Medicare Advantage plans, or vice versa for that matter? So if you're on original Medicare, you can choose your own doctor and your own specialist. You don't need a referral. So therefore, if you have a doctor or specialist that you've been particularly associated with, if that doctor or specialist accepts Medicare, then you can keep that doctor or specialist. And that gives people a certain amount of freedom, because some people live half of their life in this part of the country, some people live half their life in another part of the country. Medicare is a federal program, and therefore, as long as you're in the United States, it's going to cover you. So therefore, all you have to do then is to find another doctor that accepts Medicare, another specialist that accepts Medicare, and you are covered by your Medicare. Some people settle in one area and they don't mind going to doctors, and they want to realize more cost savings. The Medicare Advantage plans are designed, particularly the HMOs, are designed for more cost savings. You have a network of doctors to go to, and I hate to use the word confined, because these are big networks of doctors, doctors and specialists. You will need a referral to see the specialist, but you'll realize more cost savings being with a Medicare Advantage plan if it's an HMO. The PPOs are designed in such a way that you can keep your own doctor if he accepts that PPO, but you'll be charged a little bit more for that service, but you will remain in that PPO network. So that fits some individuals' budget or lifestyle, because it accommodates their medical needs. You have a particular specialist you've been working with for 20 years. Under an HMO, that specialist may not accept that HMO, but the PPO does, or original Medicare does. So it gives you that choice of medical coverage depending upon your particular needs. And so those are some of the reasons why people would choose one over the other. Let me take the time to emphasize, it does not mean that one is better than the other. It simply means that the plan that you've chosen fits your particular needs. Because we have individuals that come and say, give me the Cadillac plan. There is no Cadillac plan. The plan that you're going to choose is one that fits you and your family's needs, your particular needs. Okay. All right, so moving right along. Let me see if I'm on the right. Yes, get the coverage that you need, original Medicare, and I covered that about that. Now, the last point on this is what I want to start talking about more. You can find your Medicare coverage that best suits you by coming to the Nevada SHIP offices. Many people do not understand or know about what we do as SHIP officers or counselors. The SHIP offices are in all 50 states and in the territories of the United States. There's at least one in each of those. We are federally funded so that we can provide unbiased counseling to everyone. So we are not going to try to steer you to one particular program or one plan because we don't get commissions from them. We are interested in helping you get all the information you need and making a decision as to which plan is going to cover you for the ensuing year. So that's what we do as SHIP officers. Now let's talk about some of the special assistance programs. There are assistance programs that can help you to pay for your Medicare or your prescription drugs. These programs are based on income and resources, and the assistance varies by the type of programs. That's part of the information that we also carry at our SHIP offices, so you can call us or you can come by to see us, and that's one of the things that is part of the screening process, because we want to see that you get all the benefits that you're entitled to. So we're going to ask you about your income, about your marital status, and we're going to ask you some other questions like that. So be prepared to answer those questions, because we're not there for identity theft, and we're not there to play matchmaker. We are there to try to help you get the benefits, and because these programs have these qualifications, we need to ask you those kind of questions, okay? If you have other coverage from current employers or unions, check with your plan's benefit administrator. Many times, people come to us and they've already disenrolled from either a Medicare part or from their employer's part, thinking on the advice that they had got from somebody that wasn't qualified to give them advice. And it ends up being a situation where they can't get that insurance back. So now either they can't get their medications or they can't get the medical services that they need. That's why we encourage you to check your plan benefit administrator before you make changes, because those changes can be lasting changes. You could lose that coverage and never be able to get it back. And then you come to the SHIP office and say, okay, you're going to have to help me now. I'm in trouble and they told me you can fix it. And it won't be possible. So take the time to do your homework before you make any changes and come to us, because that's why we're trained certified counselors to be able to help you to make changes that are appropriate to your situation and circumstances. If you drop a Medicare Advantage plan and join Original Medicare during the annual open enrollment period, there's no guarantee that an insurance company will sell that a Medigap policy to you. You may have to meet medical underwriting requirements, including existing conditions and age. These are the type of things that pieces of information that you need to know in regards to making changes to any part of your Medicare plan for the ensuing year. And that's why we encourage you to come to our offices or call us on the phone before you make those kind of changes. Yes, ma'am?
Would you explain exactly what is a Medigap policy?
Okay. And that goes back to the previous question of the difference between a Medigap policy and a Medicare Advantage plan. Under Original Medicare, an individual, Medicare pays 80% of Medicare-approved costs. The individual is responsible for the deductible and the 20% co-insurance. Medicare has contracted with private insurance companies to sell what is called a Medicare supplemental policy, or the other name for it is a Medigap policy. What that plan is designed to do is, if your doctor services are covered by Medicare, Medicare pays this 80%, that plan, once you pay that premium for that plan, that Medigap policy or Medicare supplemental policy will then pick up the deductible and the 20%, thus lowering your out-of-pocket expenses for your medical services that you receive. So that's what a Medigap policy or Medicare supplemental plan is, and that's what it's designed to do.
So it does not cover the difference between the donut hole or the gap and the Medicare Advantage plan?
That's a very good.
50% now, you know, that we have to pay now instead of the Advantage where the 80% was covered.
Okay, that's a very good question. I'll repeat it for the benefit of the remote listeners. The Medigap or the Medicare supplemental plans are designed to work with Part A and Part B of Medicare. That is your hospital insurance and your medical insurance. It is not designed and does not work on behalf of your Part D, which is your prescription drug coverage. There are other federal and state plans that are designed to help you with prescription drug costs. There are three components to the prescription drug costs. One is your premium, the other one is your deductible, and the other one is your copay. There are other federal and state plans designed to help eliminate or reduce those out-of-pocket costs. But the Medigap or Medicare supplemental plan is designed to work with the Part A and Part B. Thank you for asking that question so I can make sure that I explain that.
Part A is hospital, Part B is doctor, what's Part C?
The question is asked, what is Part C? Medicare Part A takes care of, is the insurance that takes care of your hospitalization. Medicare Part B takes care of your medical, and that is your doctor visits, any tests that the doctor orders, or durable medical equipment that you may get is taken care of by Part B. Medicare Part C means Medicare Advantage plans. This is how you get your HMO or your PPO. So that is called Medicare Part C. And Medicare Part D is your prescription drug plan. So Medicare Part C, I like to think of that C as comprehensive, because your A, your B, and your D are taken care of by the one organization. So that's how I think of that C meaning, okay? Now, that have talked to you about all of these things, and they are complex, and so the time that we spent here is hardly enough time. But let's see what you've learned, okay? Open enrollment, the annual open enrollment period. What are the dates? October 15th through December 7th of every year. During this time, what can you do? In general, you can make changes to your Medicare plans. You can change from original Medicare to a Medicare Advantage plan, vice versa. If you have a Part D plan, you can change to a different Part D plan. If you have a Medicare Advantage plan, you can change to a different Medicare Advantage plan. The changes that you make during this period of time do not take effect the next month. They take effect January 1st of 2017. Okay. Steps to take, what we've covered. Receive and read the important Medicare notices that are sent to you in the mail. You get a lot of things in the mail this period of time, but pay particular attention to your ANOCs and your ELCs. That is your evidence of coverage and your, see, I knew I was going to say that big old name and forget what it's saying, but your notice of coverage that you get from your MA plans or your Medicare Advantage plans. I also want you to remember that there are special programs that are designed to help you with your Part A and B, that's your Medigap policies, or your Part D. There are federal and state programs that are designed to help you with those out-of-pocket costs. To find out about all of those things, we want you to contact the local SHIP office. That's the number. And there's a statewide number in case you have friends that are out of state. You can give them that 800 number. And on the brochures that we left for you, those numbers are there. So contact us so that we can give you the unbiased one-on-one help that you need with your Medicare so that the decisions that you make will help you to acquire a Medicare plan that's going to suit your medical needs for 2017. Thank you for your attention. And if you have any more questions, I'll be happy to take them. I think we covered all the questions. Well, yes, sir.
If you have insurance with your current employer or union coverage, that's usually a positive, is it not?
Indeed it is. As far as how Medicare, if you have a current insurance, then Medicare pays is secondary to that current insurance. And Medicare also allows you to not pick up parts of Medicare like Part B or Part D if you have current employee coverage, because employee coverage usually provides those either medical insurance or prescription drug coverage that is equal to or better than Medicare. So Medicare has a provision that allows you to save yourself a little money because you're already covered under your current employer or union insurance.
So when we have this time frame from October 15th to December 7th, we want to seriously think if we're under that, not to drop that unless we know we should.
The question that's being asked is that if we have employer or union insurance during this period of time, the open enrollment period of October 15th to December 7th, we want to make sure we don't drop that. So, and that's a very good point. When you have current employee or union insurance and you come to our offices, we're going to talk to you about that and make you aware of what can be, what you can decline to enroll in, what you should not decline to enroll in, and the effects of that, so that you'll know whether or not there's a penalty associated with it, or if there's no penalty associated with it, or if there's a delayed penalty. We'll also talk to you about the timetables that are associated with each of these parts, because Medicare makes those allowances. Yes, ma'am?
One of the main reasons I came was to find out if there's any relief for the gap, the drug coverage gap. We've been in it since August this year because of 2 medications that he takes for Alzheimer's. They're very expensive. So since August, I've been paying $184
Mhm.
per day for 1 month for one medicine. And the other is $141.
Okay.
Is there any way that can be dropped or lessened? For,
Hmm?
5 months is a lot of money.
Okay. The general, the beneficiary has a specific question, but I'm going to make it general first and then answer you specifically. Does Medicare provide relief for those who are in the medication coverage gap? The answer to that general question is yes. There is a state of Nevada application that you can fill out if you meet the income qualifications that can help you with that. Now, let's say you don't, and I haven't talked to you personally, so I don't know, and that's what I would have to do. Let's say you don't meet the qualifications of that state program that is available. There are other programs that are available that we can give you the information on to see if they can help you with relief of the medication cost. So the point that I'm making is don't refrain from calling or coming in to talk to us just because you think you don't qualify for a program, because there are other resources that we know about that may in fact help you if Medicare doesn't provide a resource. Yes, ma'am?
Okay, this is probably a really dumb question, but.
Okay, don't ask it. The beneficiary is about to ask a question, and I want to emphasize that there is no such thing as a dumb question, because if you don't know the answer, then you need to know the answer, and we are here to give you the answer. So,
Okay, so I don't know because I don't have Medicare yet. So does original Medicare cost a monthly premium, or is that what has been taken out of our checks from whatever? And the costs are really the 20% after the 80, right?
okay. So,
They're a monthly premium.
okay. So, the question is asking, let me kind of reword the question so that I can answer that whole concept. The question goes to the cost of original Medicare. The best way to answer that question is to say this. A person who decides to stay on original Medicare will bear the following costs. You will pay the deductible of Part A and Part B, and you will pay the premium of Part B. Many people don't have to pay the premium associated with Part A because they've worked for 10 years, which is 40 quarters in the Social Security system. That pays for the Part A premium. So when it comes time to get your Medicare coverage, Part A is put on your card because you've already paid that premium. There is a provision for those who haven't worked those 40 quarters to pay for a premium Part A. But generally speaking, that's not the case. Part B, however, does have a monthly premium associated with it, so that when you enroll in Medicare Part B, then you will either pay that premium to Social Security, or you can have it arranged to come out of your Social Security benefits. That is one of the things that is given to you as an option. Associated also in payments of an original Medicare is your Part D, or prescription drug plans. There are premiums and sometimes deductibles associated with it. And again, you are given the option as to whether you pay that directly to the plan by means of an electronic or a booklet, or you can have it deducted from your Social Security benefits. Those options are presented to you when you sign up for your Part D prescription drug plan. The Medigap, or Medicare Supplemental Plan, is a private insurance plan. It has its own separate premium that you pay to whichever of those companies that you decide to go with to realize that coverage that helps you with your Part A deductible, Part B deductible, and Part B excess charges. Yes, ma'am?
Along with the premiums, say I don't have my 40 quarters in,
Okay.
all right? What do I have to pay? And then there's penalties, we didn't talk about that at all.
Okay.
So you might just want to just,
Go over that. Okay. The question is, if say you didn't pay your Part A premium, what do you pay and what are the penalties associated with it? The amount of the Part A premium, and for that matter, the amount of the Part B premium, varies from year to year because Congress sets those rates. They determine it. Like for instance, for the year 2016, a person who didn't pay the 40 quarters will have to pay a little over $400 for the Part A premium. There is a penalty associated with it if you don't get it when you were supposed to, which is if you are qualified for Medicare at age 65 years of age and you didn't get it till later, then you'll pay a penalty associated with that for a brief period of time. Then Part B has the same thing. If you do not get your Part B when you're first supposed to, then there may be a penalty associated with that. This year, the Part B premium is $121.80. That's going to change, and we'll know sometime during the month of November what that's going to be when we get that information. And that is a per month charge, just like the Part A. If you didn't pay into your premiums, pay into your Part A during the Social Security, then it's a Part A month-to-month premium. But those are subject to changes by Congress, and also the Part B premium. Those changes are also associated with a person's income. So you may be charged a bit more for your Part B premium depending upon your income. And that's the reason why I didn't cover it in this, because then it gets into a little bit more technical part that we'd rather have you sitting down in the office with, because that's a lot to explain. Yeah. But anyway, we're going to talk to you about the penalties, how to avoid those penalties, what the timelines that are involved in each part of Medicare to hopefully keep you from having to pay those penalties. Okay. Thank you all. Were there any questions from the remote sites? Okay. All right. So I want to thank everybody in attendance. You have our card, so please call us. There is no dumb question. If you knew an answer and forgot it, call us, because that's why we are here to help you. Thank you, everyone, for your attention.